Hello everyone, my name is Wandamo Yirga. My presentation is on addictions, specifically focusing on opioid use disorder. When we see the definition of opioid use or addictions, addiction is considered as a treatable chronic medical condition that might be complex at times and it may involve impairment of the body system. So a person who is experiencing might have a brain circuits affected, and genetic and environmental factors might be also affected under individual's life experience. People with addictions may use different kinds of alcohol, and it can be in a different form that people might be engaged in a change in behavioral conditions, and sometimes they become compulsive and often continue to despite harmful consequences. Some people, they understand the harmful effects, but they continue using those types of drugs or the alcohol that may make them concurrently use with different substances. Opioid use disorder, on the other hand, is considered as or defined as it's a pattern of opioid use, which is problematic as well as it was defined on the first one, and this is also significantly causing impairment in one's body function. It's often diagnosed using the DSM criteria. So opioid use might cause an individual to crave for something, and it may continuously affect the health of the individual negatively. When we see the addiction, particularly opioid use, continues to be a significant public health crisis, and the main reason and purpose of this presentation is to explore the current practices and research going forward to present this current practice into effect based on the Healthy People 2030 Objective SU18. This presentation is going to explore some research studies and recommendations so that this might be implemented in the future practical settings. Objectives has been set in a different way. Different people, different investigators set up objectives, and the Healthy People 2030 Objectives has been set up in a way that the percentage of opioid use disorder can decrease through the time. So from 2% to 2.2%, and eventually the plan was to reduce to a 1.7% by the end of 2030. And also improving the treatment plan and encouraging providers to use evidence-based practices to lower down the percentage of individuals who had opioid use disorder within the previous year. And also implementing those initiatives such as like expanding programs that may reach out to people who are still far away and bringing those gaps into practice by prescribing opioid treatment medications. So those are like objectives that are just generated in a different way, but Healthy People 2030 SU18 is to reduce opioid use in the previous year. The statement of the problem, when we see that as we all know, the opioid epidemic has been declared a public health emergency, and also which is associated with opioid overdose, which is a leading cause of accidental deaths driven by the shift from prescription opioids to heroines and then to illicitly manufactured fentanyl, which is 50 to 100 times potent than morphine. As compared to morphine, fentanyl is more potent. So the use of some of the injectable opioids increase the risk of infectious disease, so HIV, including HIV and Hep C, which is common among people who are addicted to drugs. And if we see, it's considered as a burden. So in general, the Healthy People 2030, as well as The Substance Abuse and Mental Health Service Administration defines figures as like 25% of people age 12 and above are addicted to illicit drugs. The data on opioid use disorder and mental health co-occurrence is very common. If we see that mental health is close related and it's always appearing together at the addiction centers, because I also work in addiction facilities, and most of the time people may have one or more mental health problems concurrently together, or they are overlapping. And also the treatment gap is also one of the problems that needs to be narrowed down, and barriers to access and treatment are also problems for to address these kind of issues. And high rate of mortality, morbidity, and disability are very, very problematic in the healthcare system, and they are also considered as a burden. Americans, like around 2.1 million Americans, have been annually being diagnosed with opioid use disorder. Unreported cases who are staying at home due to certain reasons or inaccessibility are also uncountable out there. Opioid overdose is one of significantly affecting people, and we found out that the remaining leading cause, which causes injury related to death in the United States, and this is worsened, as I said earlier, up to 10 times by fentanyl use. Fentanyl consumption is causing people to die of it because of overdose, limited access to treatment, and also stigma might hinder this kind of services that people are seeking, like treatments. If we see the CDC reports that there are 3 waves of opioid overdose deaths. They try to see the rise in figures from 1900 all the way down to 2023. It shows that the reports showed that there was a slight decrease between 2022 and 2023, which means the days where 217 people were dying every day as a result of opioid overdose. And stigma, as I mentioned earlier, stigma is one of the persistent obstacle to seek treatment, because a stigma remains one of the most significant barrier. And the philosophies of treatment, the thoughts of the people in the myth are out there by telling people that some group of people were telling, oh, they are substituting one addiction for another one, which is actually cultural resistance that limits people from seeking treatment for addictions. Current literature also shows that they were studying different topics, but I found that most of them, they study effectiveness of medications, integrated behavioral and primary care models. They try to study those, and the harm reduction approach were also one of them. Barriers, stigma, financial things were being studied, and recent studies support, mainly recent studies, that the last one, what I like is most studies are supporting combining medication assisted treatment, which is MAT, with counseling is the best it gives the best outcome. The consideration of having the best outcome is because the combination of counseling and medication assisted treatment. Otherwise, it was going to be difficult because, as I said, I was working at addiction medicine residential facility, and people within 3 days, they want to go back where they came from because they're super addicted, they're in withdrawals, and they want to go and start using that medication. But counseling, physical therapy, counseling, and therapy supports them to transition to be free from opioid addiction. Healthy People 2030, they highlighted opioid use as a priority. So nationally, there was a movement to consider opioid use as a main targeted public health problem, so that we can revert. And over 80,000 overdose deaths was reported by CDC. and close to 1.2 trillion dollars are being spent because of this. And high relapse rate without evidence-based treatment, because high relapse rate is due to dropout of treatment. They may leave, they may walk out, and they may not come back, or they come back again, but after everything was bad, they'll return back, they start again, they go and they come back. The relapse is very, very challenging as well. So I chose two studies, but the first one, two studies around this topic, and trying to look into these studies to critique as well. So YZ studied, YZ, I just say YZ. YZ studied expanding access to medication for opioid use disorders through locally initiated implementation. So those are like overviews. They try to they try to choose a setting, and they studied this at the clinic setting. With the study design was observational implementation study, so it was locally selected clinical setting. They try to study further about the expansion possibilities at that specific setting. So the purpose of the study was to evaluate the strategies to expand the medication for opioid use disorders. The samples were selected from the clinic, or those are selected, and the target populations were adults. Those people who are coming to the clinic were selected as a target population to study, and those studies were reportedly it looks like there is a moderate representation, because some clinics, they opt in to study group and some of them dropped out. It's a willingness to opt in and study, to participate. Selection bias was likely because clinic setting might be, they may differ from being participant or non-participant. Some of the variables are the independent variable and dependent variable. Implementation of medication for opioid disorders are considered independent variable, and dependent ones are extent of the MOUD EXMA provision. Like patients receiving this kind of treatment are also considered. Measurement is like clinical records reliable for services, shows that the clinic records are reliable for service provision, because if we dig into clinic reports and EMR system and everything, if we review the service provision, it may actually give us some ideas. However, it doesn't measure actual OUD prevalence or patient outcomes. Confounders can be community characteristics, patient demographics, male or female, or gender, or different kinds of perceptions might be considered. In general, we can say it increased accessibility. That's what they found out. And feasible potential for scaling up. The strengths of the study, this is like a real world study, which is practical, that is practical and very relevant, and it gives a bridge to more research, and research can be conducted. It provides like insights for policymakers, because the study result shows that it's a good progress and expansion is increasing. It does not measure patient level outcomes, are not measured, because earlier I mentioned that this is not measuring outcomes. Selection bias at the time of the clinic level, no long-term follow-up, because it's a one-time study, experimental, but it's one-time study. There is no follow-up. The second study was Patel and his groups studied effectiveness of community-based harm reduction and treatment engagement on reducing opioid use. Since the Healthy 2030 objective is to reduce opioid use, this study is clearly indicating the outcome. The study design, prospective multi-site cohort study. This was like for 4 years, and they studied for 4 years, which is like a longitudinal study, and the purpose was to evaluate the effectiveness of harm reduction strategies being implemented within the community. Samples were selected, like 3,842 adults across 12 communities were selected, and they participated in one group, in a different group. So they were targeted as adults were targeted and diagnosed. Those adults who are diagnosed with OUD and receiving treatment at the community where those specific group of people were selected to participate. Representativeness is still moderate because it includes urban and rural population, but only participants seeking treatment were included in that study. Selection bias is likely because of self-report or self-selection. Study design, prospective design actually allows monitoring over time, multi-site, increased external validity, but limitations. There is no randomization, there is no randomized control groups, there is no causal inference, there is no cause and effect, and it's very limited. Future studies are actually very recommended to continue the difference based on the fact that these points can be addressed. So diversity is one of the very important parts of this study, and it tried to include all participants. Implication for nursing and healthcare. Nurses are central, and must assess that recommendations, conduct longitudinal cohort studies are actually quantified. This is a good one, and we recommend that the effectiveness of combined interventions, behavioral therapy, and medications are highly recommended. Study social determinants needs to be studied further, and further research needs to be conducted. And training is very important. Educating professionals, a different team of professionals working together might be helpful. Working together is definitely needs to be part of the educational material production. Education and treatment, like education curriculum, people needs to know what is going on. Peer support, leveraging, helping each other, bringing them up is a great thing. Pharmacy access, encouraging those local pharmacies in giving incentives for pharmacies that may help pharmacies to develop more productivity. Conclusions, now coming to an end, OUD remains critical public health challenge, and for this, coordinated clinical and public health strategies are very, very important. Also, medication-assisted treatment needs to be combined with behavioral therapy. And also, barriers in the community like stigma, as we discussed previously, needs to be addressed. And reducing OUD prevalence, it requires coordinated effect. Meeting healthy people 2030 objectives are very, very crucial to overcome or treat and stop the danger of opioid use disorder. And these are the references, and thank you so much.